Do you find yourself waking up each day reaching for that cup of coffee or energy drink to get your day going? If you do, you're a part of the 90% of Americans that consume caffeine on a daily basis. Caffeine is one of the most common and widely used drugs in the United States. I personally use caffeine on a daily basis and have experienced both positive and negative effects of caffeine. So first off today, we will talk about the benefits of caffeine. Now, I used WebMD. They had a really good article on their website discussing the health benefits of caffeine, and it was pretty interesting to find out that consuming caffeine daily can help reduce your risk for certain types of cancers like throat and mouth cancer. It can also help potentially reduce your risk for stroke and coronary artery disease. It is associated with a better memory, and if you partner it with aspirin, it can be used as a treatment for an over-counter pain reliever to help treat headaches and pain anywhere on your body. So now that we've discussed the benefits of caffeine, I'll move on to discussing the side effects of caffeine. Now, the risks associated with overconsumption of caffeine is very detrimental on your health if you keep doing it over and over on a daily basis. It can cause, according to Healthline, Healthline.com said that overusage of caffeine can cause insomnia, dizziness, and anxiety. It can, you can overuse it so much to where your body becomes addicted and you are dependent upon caffeine, so your body wants it every day. Caffeine can also cause stomach ulcers if taken too much, and can also trigger irregular heartbeat, and which is not good on any level. So now that we've discussed both the side effects and benefits to caffeine, we will switch over on how to regulate caffeine intake. Lowering your consumption of caffeine is great. If you could not use it at all, it would be better. The Mayo Clinic had a really good article on how to regulate caffeine intake or completely rule it out of your diet. But they suggest that when you go to the store, you read labels and make sure that there's no caffeine in the products you're using. And definitely always read everything you buy. It also said that the FDA recommends that the daily intake for caffeine be between 200 and 300 milligrams a day, and any less than that would be more beneficial to your body. Also, they suggest that you drink lower caffeinated products or caffeine-free products. Decaffeinated products such as teas, coffees, sodas are good choices. And then caffeine-free products such as milk, juice, and water. Always when you go to the pharmacy or Walmart or Walgreens or wherever, always ask your pharmacist for products that are caffeine-free, especially if you're buying over-the-counter products. because it can really save you on some of those issues you might have with caffeine. So, as you can see, caffeine usage in moderation is definitely okay, but overconsumption can lead to health problems in the future. In conclusion, caffeine is considered one of the most commonly used drugs in the United States that can affect your overall health, and halting usage or lowering usage is really beneficial. So on that note, today I have discussed with you the benefits, the side effects, and how to regulate and lower your usage of your caffeine intake. And next time you go to grab a caffeinated drink or a cup of coffee, remember there are great alternatives out there that you can buy. And I thank you for listening, and I hope you learned something new today.